Alright Sherry, as we have already discussed the pros and cons of whitening, today is the D-Day, so we will be doing the procedure today. So the first thing that we need to do is obviously get all the plaque out of the patient's teeth, because we need the teeth to be nice and clean for the gel to be able to penetrate. This is called the liquid dent. This is what's gonna actually protect the gum. So what we do is we squeeze this all around. What the whitening actually does is it just makes the process a bit quicker. The light has nothing to do with how much whiter they go. It's actually the gel that's bleaching it, and the light's activating it and making things a bit quicker for us. Alright, it's all done. I'm gonna move this now to the side, and time to clean up. So we'll be telling Sherry to avoid coffee for the next 3 days, red wine, red sauces, curries.